Welcome back to Pharmacy News. Joining me now, Dennis Bastas, Executive Chairman of Arrow Pharmaceuticals. Great to have you with us.
Morning, Miranda.
Now tell me, you've been working on some amazing innovations in terms of sustainability. Can you tell me about that?
Sure. Arrow Pharmaceuticals plays an important role to our customers. Certainly their ongoing viability as a business, as a financial concern, is a significant part of our strategy. We find that our customers are looking for not just a business partner that supplies them products, but someone who becomes an integral part of what are the elements that are going to drive their future sustainability with their customers and in terms of their business. So we are developing professional services, we're developing the kind of adjunct services that when a patient comes into a store, they'll see their relationship with their pharmacist as being more important to their overall health and wellness, and products at the end of the day will flow from a much more service-related environment in pharmacy. So Arrow's working on programs that involve the use of technology such as genetic testing, such as apps that inform people that their medications are ready for pickup, and it brings the pharmacist and the patient closer together. So where a patient sometimes may only spend 50 or 60% of their time with one particular pharmacist, we want to see that our customers get to enjoy a much longer lasting relationship that means they'll get 70, 80, 90% of their business, as opposed to a more transactional relationship that oftentimes pharmacy gets to create with their customers.
Have you had much feedback from pharmacists in terms of challenges, and what have you done to overcome them?
Yes, absolutely. So again, Arrow, as a generic pharmaceutical supplier, is one of the companies that has the largest field force in pharmacy. Mm-hmm. So we've worked together with our pharmacy customers through our field force to get the feedback, what's important to them, what their needs are, where the challenges are. And that means we've also extended our partnerships. So Arrow's worked with a number of the major multinational pharmaceutical companies who don't really have a presence in pharmacy. They tend to be detailing to doctors, and we've extended that relationship in terms of building services to support them and bringing the multinational branded pharmaceuticals and services that should go along with that into pharmacy, which in the past has been difficult for the multinationals to do. They focus on a different agenda, but they also see now that they're part of that whole ecosystem, and Arrow's playing a strong role there in bringing other partners through our network and through our pharmaceutical representatives into pharmacy.
Very exciting times.
Right.
And what's been the response so far from pharmacy?
Pharmacists have loved it. Pharmacists are seeing that kind of environment will allow them to get over some of the regulatory hurdles, some of the pricing hurdles that we all get why the government needs to find more sustainable ways to reduce the cost of pharmaceuticals to the patient as well as to the taxpayer, which means we have to get creative. We have to provide and substitute services that people go elsewhere for, and even products they'd buy in a different environment, and move them to pharmacy. And that relationship's increasing overall the retail value of pharmacy for the pharmacist and for their patients.
Congratulations, exciting times ahead.
Terrific.
Thank you so much for your time.
Thank you, Miranda.
We'll be back with more Pharmacy News shortly.